Good afternoon, everyone. Good afternoon, and welcome to the third White Coat Ceremony here at Bay Path University. I guess technically it's the first White Coat Ceremony at Bay Path University. Maybe many of you don't know, but we have changed our status from college to university status as of July 2014, so this is the inaugural White Coat Ceremony of Bay Path University. Welcome, family and friends. It is also the inaugural White Coat Ceremony that's being webcasted across the world. I understand we do have guests that have joined us, so thank you for coming and welcome. It's my pleasure to introduce our University Provost, Dr. Melissa Morris-Olson, to welcome us here today.
Good afternoon. I am so pleased to add my words of welcome to this celebration, our annual White Coat Ceremony for the MS in Physician Assistant Studies program here at Bay Path University. And it is indeed a wonderful cause for celebration. For those of us who were involved at the inception of this program a little over 5 years ago, it hardly seems possible that we have now enrolled our third class and that our students are at this important point in their journey. It's really a treat, too, to see graduates of the program here back with us for this celebration. I want to add an especially warm welcome to those of us who are joining us from around the country, as Dr. Hickson said, many family members and friends, and we are so very pleased for your presence as well. A couple of words to our students who will be joining us shortly. Our students occupy, and this is really meant for family and friends as much as it is for our students occupy an incredibly important and privileged place in the history of this program and university. The PA Studies, the Physician Assistant Studies graduate program, is a highly competitive and rigorous program. There were 30 slots for this year's class. There were more than 600 applicants for those 30 slots. And so one of the things that you should take heart in knowing is that by virtue of their presence in this class, your loved ones, your family members, friends who are members of this class are already well on their way to establishing themselves in their chosen profession. It is indeed an honor that they were selected. I can tell you that the selection process is a very, very rigorous one. Dr. Hickson and her faculty are very, very rigorous. They have set up very clear and high standards in terms of the selection process. And so you should be very proud of the fact that they are members of this class and have embarked upon this career that is such an incredibly important career in today's world. We like to say at Bay Path, and I think Dr. Hickson started us off by saying, Bay Path needs more PAs, the world needs more PAs, and we're really, really glad to be able to play a part in meeting that need, and you should feel proud that your family members and loved ones are also here and will be a part of meeting that need. I want to recognize George Keaty, who is the chair of our Board of Trustees. There he is. Our trustees played a hugely significant role in supporting the launch of the PA program, and we are so grateful for their continuing support and involvement. Without their support, this program would not exist on this campus, and so thank you to George and to his colleagues on the board for their continuing support. Dr. Breton, our speaker, we are so pleased that you are here as our keynote. You have already endeared yourself to students and to faculty alike and left your imprint on this program, and we look forward to hearing from you shortly. And finally, I want to recognize and thank our founding program director, Dr. Jennifer Hickson. Dr. Hickson has literally poured her heart and soul into the development of this program and the ongoing care and nurturing of the program, the faculty, and our students. And I cannot think of a better role model for our students than Dr. Hickson and her outstanding team of faculty, many of whom, if not all of whom, are here seated in the front row. So again, thank you for your presence. I look forward to seeing you all back when your loved ones are graduating, and it will be here before you know it. We'll be shaking their hands at commencement and celebrating with you in that achievement as well. So on their behalf, congratulations and enjoy the ceremony.
Thank you for those words. Can I ask the audience to please rise? Mr. Picard? And honor the class of 2016. Will the audience be seated, but the class of 2016, please stay standing. I just want you to know, not a few hours ago, this group was sitting in a classroom, heads down, taking their last final for this fall one semester. They are looking better, and I bet feeling better. Feel better? All right, class, this group in front of you have brought you to this place. So please, however you could do it, show them your appreciation for all they've done for you to bring you to the stage. Do something. Please be seated. I'd just like to take a few minutes to introduce a very special group of innovative thinkers, dedicated faculty that will bring these students to accomplish their dreams. Dr. Elizabeth Fleming, who's the Associate Provost and Dean of Education, Human and Health Services. Please stand, Dr. Fleming. Our Medical Director, Dr. Sudeep Alak. Assistant Director in my right hand, Teresa Rethel. Distinguished Professor, Dr. Robert Hoffman. And with that in a gram stain, coffee. Director of Clinical Education, Stephen Lee. Dr. Edward Tessier. Where's Ed? There's Ed. Dr. Christine Bacon, the chair of the Science Department. Lisa Adams, our executive program manager. Gina Marone, who are administrative assistant. Gina, you're always the furthest away, and I make you come to the stage every year. Come on. G keeps us all in line, organized the best she can because we don't listen sometimes, but that's the way it is. Some other distinguished guests in our audience, advisory board members, preceptors, some of our clinical faculty members. Just for a quick mention, Dr. Michael Balin. Thank you, Dr. Balin. Dr. Christine Sickle. Dr. Sickle? I know you're here. Physician assistant, Phil Yanni. Phil's been a PA for 36 years, the only one in the room that can bypass my record. To you, Phil. PA Brian Katz. Brian? Physician assistant Rachel Dakota. Rachel? Our adjunct faculty, Leslie Smith-Frank. Leslie? Advisory board member and dear friend, Mary Lou DiGiacomo. Where are you? There you are. Adjunct faculty, Dr. Eric Churchill. Dr. Churchill. A very special guest, physician assistant Tom Quapian. Tom is a graduate of the inaugural class and was the class president, a great leader, and I'm sure will be a great leader in our PA community, so thanks for coming, Tom. I really appreciate it. I would like to ask now Assistant Director Teresa Riethel to the podium to talk about the history and meaning of the white coat and to introduce our keynote speaker.
Wow, it's a lot of people out there. So welcome to this great evening. Becoming a physician assistant is a life-changing opportunity, and tonight's donning of the white coat is really the first step into this larger world, not only in medicine, but in what we can do with that responsibility that we achieve. For over 100 years, the white coat has served as the preeminent symbol of physicians and, more recently, physician assistants. It demonstrates the transition from the didactic phase to the clinical health sciences, or as we like to think about it, from the classroom to the clinic. The short length of the white coat worn by students and the full length worn by certified or licensed providers is a long-standing tradition and remains a mechanism used by patients to determine and identify the role of each care provider. The white coat is also viewed as the cloak of compassion and a symbol of the caring and hope patients expect from their providers. The white coat for PA students helps define guidelines regarding the expectations and responsibilities appropriate for the medical profession. It's a declaration of commitment when students accept the obligations of our profession. Sir William Osler once said, "The practice of medicine is an art, not a trade, not a calling, not a business. You've answered that call. Congratulations." It's now my honor to introduce our keynote speaker, Dr. Joseph Breton. I know for myself and for the faculty, we've known Joe, as we like to call him, for a long period of time. He's been an internal medicine specialist for nearly 20 years, practicing predominantly in Connecticut. He's an exemplary example of what a healthcare provider should be. He's compassionate. He works tirelessly for his patients. When I visit him on site visits, he cites me literature of the most up-to-date evidence-based medicine that makes me feel quite unknowledgeable at that moment. But he uses this information to treat his patients appropriately and to teach our students what this information means and how they can bring it to their practice as well. I have heard through the grapevine that he's also been known to ask patients to join him in his intense physical training in his garage when they accomplish certain tasks. When he's not practicing medicine or teaching our students, He's a team physician to Brazilian Jiu-Jitsu, UFC fighters, which I personally think is very cool, and to some local team sports. He also serves as a board member to the Department of Child and Youth Services. He's been served on our advisory board. He's been with us since the beginning, and he's a great friend to us personally and professionally here at the program. I think probably one of the things that he cherishes the most is his family, and I just got a quote from Jade, his lovely daughter here, who said he's the best dad ever. So please welcome to the stage, Joe Breton.
Thank you. Yes, I've been a physician for 20 years, and you're probably thinking, wow, he looks like he's about 30, right? Why are you laughing? No. So, congratulations, first of all. Excellent. Tell you a little story about this shrub that I had in my yard about 15 years ago. And all summer, this shrub just blended in. Looked like all the other things in my backyard. And then winter would come, and it would snow and rain, and it would get covered, and you couldn't see the shrub. And I'd walk out there and step on it, break the branches. And then in the spring, every spring, early spring, it would produce these beautiful flowers. Beautiful. Like nothing I'd ever seen. It was the first sign of spring in my yard. And they lasted for about a week, and then they would die and fall off. And then the shrub went back to looking like every other shrub. So, I was a young man then. And I thought to myself, it only really blooms for a week, and the rest of the year, I have to work around this shrub. It didn't make sense to me. I thought, it's not really worth having if for 50 weeks of the year, it really doesn't do anything. So, like a good guy, tied a chain around it, attached it to my truck, and I pulled it out. And then I threw it in the woods. And I planted grass, and it grew, and I forgot about it. All year I didn't think about that tree until the spring. And that early spring, there was no bush. There was no shrub. There was no flowers. And for 15 years or so, that has bothered me that I did that. And I thought this year, why am I obsessed with what I did 15 years ago to a shrub? Because I can tell you, out of all the mistakes I've made in my life, that's a really small one. And then I realized that that shrub pretty much represented my life and your life. And that most of the time, we just blend in. It's very rare that we show who we are. It's very rare that we can kind of bloom. Tonight is your blooming time. And as you know, and I know, you have been covered in snow and rained on and iced over and stepped on. But in the spring, you have your shining moment. And this is your night tonight, and you should be very happy about it. Because you know also that, like that shrub, it's very short-lived. You will see this pattern throughout your whole life. And even though you are in the 3 to 5% of society that has made it to where you are, because as you know, rather people can't or don't have the opportunity or won't try to make it to where you've made it. You're an elite class. You may not feel that way at times, but you are. And as you venture out into the clinical realm, I'm going to tell you something that was told to me and rings in my head very often. There are days at work when you leave work and you are going to feel like a hero, like the smartest person in the world because you figured out something, you saved someone's life. They saw 10 specialists, nobody could get it, and you're going to get it. You're going to drive home and you're going to feel great. And there's other days that you're going to leave work and you're going to put your stethoscope down and you're going to feel like you should never pick it up again. And that's the career you've chosen. But we hope that most of the time you're feeling like a hero. Once you're done with today, you go back into blending in on campus unless you're a complete psychopath and you wear your white coat every day, no matter where you go. And that's an option. That's an option. So congratulations on what you've done. I'm going to ask you to not do something tonight. It's going to be a little difficult for most of you. Anyone over probably 35, it's not too hard. I'm going to ask you, just for a few hours tonight, that you don't post anything on the internet about what you've done. And the reason I'm going to ask you to do that is because, as you know, nobody understands what you've been through. They think they do, right? So you talk to your friends like, oh, I have a final in 3 weeks that I have to study for. And they're like, I do too, man. That's why we should party. Nobody understands what you've been through. So I want you just to keep it together, because only you people that are together in the class understand how hard it actually is. And other PAs and physicians know as well. They won't understand what you've been through. If you have to post something, go ahead. I know it's tough. I know it's tough. So I wish you luck in your clinicals. And I'm sure you'll do well, because this is a great program. Unfortunately, I didn't get a chance to come and torture you because I was too busy, but hopefully I'll get to. And I wish you luck. Thank you.
You can see why our students love him. So do we, for that matter.
Thank you.
Joe.
Thank you very much.
We have a little something for you since the winter's coming and the snow is going to cover you up
Thank you.
to get you through till the spring.
That's awesome. Because with Obamacare, I can't afford heat. Thank you. Was that okay to say?
Oh, well, I can always find another place to work. Maybe. Don't worry about it, Joe. Joe, got any openings down there? Thank you, Dr. Breton. Okay. Wow, what great words. It's really something. All right, it is now my pleasure to introduce the class president of the class of 2015, Wang Trin. Wang?
Well, it's really hard to follow that one, Dr. Breton. Thank you for that. Welcome. Hello, everybody. Distinguished guests, family, friends, and everybody out there in the far regions. Hello. It's my honor to speak on behalf of the class of 2015, the mentors of the class of 2016, the group that we are honoring tonight. This is our message to you. Dear class of 2016, congratulations on this milestone in your career. It is our pleasure as your mentors to continue the tradition of gifting you with your first official white coat, just as our mentors have done for us. As you move ahead adorning your white coat and integrating it into your professional identity, may you never forget its significance. This additional exterior layer is more than a white cotton complex shielding you from the myriad of bodily fluids, contact strands, and the occasional coffee stain through clinical practice. It endorses a symbol of clinical responsibility and can bear many expectations. For patients, they will look to you for answers and direction. They will look to you for your expression, tone, and approach for insight into the level of their disease. They will hang on to your words in those critical hours as you deliver news. whether good or bad. Most of all, they will entrust in you with their livelihood, one of the greatest gifts and honors of all. Other providers and staff will look to your leadership. They will look to your actions to set the tone. They will depend on you to perform at your highest capacity and anticipate the next move in management. They will trust you to act as a vital role in the team to help deliver the most effective care. While others may expect much of you, it is even more important that you expect more from yourself. As the road to success is never traversed without due diligence, remember it is up to you to uphold the privilege to care for patients when they're at their worst and most vulnerable. It is up to you to enact empathy and respect when it may be toughest, and be advocates for their health. It is up to you to keep up and push for greater clinical knowledge to give your patients the best fighting chance. When you wear this white coat, you represent more than yourself. You represent the PA profession. You represent your roots, your obstacles, your triumphs. You represent everyone who has helped get you to where you are now, many of them here today. Moving forward, you have another team of support. That's us. And we'll be there for you as you strive to be the best physician assistant you can be. Sincerely, your mentors, class 2015. Thank you.
May I ask the faculty to come forward for the coating ceremony? As part of the ceremony, the class will receive a copy of that letter addressed to them, given to them by Wang from the class of 2015. Ready? Okay. Shall we get on with it, class? Yeah, okay. Now's the time. All right, Rebecca Allison. Joshua Arnaldi. Nicole Barbarin. Brian Bouvet. Melinda Berg. Alyssa Bobie. Amber Bowman. Peter Colleran. Ernest Darko. Whoopsie. Hamid Davoudi. The low arm. We're going to have to practice this. David Decoto. There he goes. Eric DiBiasio White. There you go, the low arm. That's it, Steve. Federico Fernandez. Elizabeth Forney. Scott Hinman. Ryan Laferde. Kristen LaFontaine. Gregory Marakovitz. Lauren Phillips. Ashley Prue. Bethany St. Laurent. Katie Titchner. Did I get it? David Toon. David, I think this is your family? Far away? Is that right? David Turo. Excellent. Victoria Berengia, excuse me. Caitlin Vu. John Whitney. Zachary Weissman. Well done, Steve. Ladies and gentlemen, the class of 2016. All right, everybody up. Everybody up. I'll keep them up. Thank you, everybody. Will the class stay standing, please? And now, Dr. Robert Hoffman will lead the students in the physician assistant oath of professional practice. Dr. Hoffman.
Please repeat after me. I pledge to perform the following duties with honesty and dedication.
I pledge to perform the following duties with honesty and dedication.
I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings.
I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings.
I will uphold the tenets of patient autonomy, beneficence, non-malfeasance, and justice.
I will uphold the tenets of patient autonomy, beneficence, non-malfeasance, and justice.
I will recognize and promote the value of diversity.
I will recognize and promote the value of diversity.
I will treat equally all persons who seek my care.
I will treat equally all persons who seek my care.
I will hold in confidence the information shared in the course of practicing medicine.
I will hold in confidence the information shared in the course of practicing medicine.
I will assess my personal capabilities and limitations, striving always to improve my medical practice.
I will assess my personal capabilities and limitations, striving always to improve my medical practice.
I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine.
I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine.
I will work with other members of the healthcare team to provide compassionate and effective care of patients.
I will work with other members of the healthcare team to provide compassionate and effective care of patients.
I will use my knowledge and experience to contribute to an improved community. I will respect my professional relationship with the physician. I will share and expand knowledge within the profession. These duties are pledged with sincerity and upon my honor. Congratulations, well done.
Thank you, Dr. H. Now I'd like to introduce the vision and the force that leads Bay Path University, our university president, Dr. Carol Leary.
Thank you, Jen. Thank you. I must admit, this is one of the high points of the entire academic year for many of us, and personally, it gives me the chills every time I'm here. So first and foremost, congratulations to the class of 2016. Dr. Breton said that you certainly are the cream of the crop when you think that out of 600 applications, only 30 of you were selected. And obviously with that comes great responsibility. But I know I speak for everyone in this audience. We have no doubts that you will do extremely well in this field, because you obviously have the heart and the mind for it. So congratulations. I know that all of us in this audience are so very proud of our students, and it takes a village to create a program like this. And I guess my theme for tonight is gratitude. As I consider the third class that has entered Bay Path University and the first under university status, I have to thank a few people, and George Keaty represents our Board of Trustees. Without their commitment, as our provost, Dr. Melissa Morris Olson, said, to the creation of this program, and even more so to the building of a 57,000 square foot building in East Long Meadow that will house the physician assistant and occupational therapy and other health science programs, we would not be here. So George, thank you on behalf of all of us for your belief in this incredible dream for these students and for Bay Path. Thank you so much. And you need someone who is the person who gets up every day and says, I am going to make this the best physician assistant program ever in the United States, in the world. And Jen Hickson, in her interview, we knew that was the way she was going to lead this program. So we are very fortunate to have Dr. Hickson as the director of this program. She is a visionary. She is a person who wants the very best quality in this program. And so, Jen, we thank you very much for all that you've done to bring a great faculty, great clinical practitioners and partners, our preceptors, our advisory council members. It does take a village, and she was the beginning of that village. And so I hope you'll help me thank Dr. Jen Hickson. Our faculty truly believe in our students, and you can tell every day when they teach. You can tell with all the extra hours that they spend advising. Our students from the very first program to the second class to this class can certainly verify that if you have any doubts. So we are very grateful to the faculty, the preceptors, the advisory council, all those clinical sites that we have for our students. But I have to tell you that I've selected the theme of gratitude because of a woman I had my last appointment with today. And for me, she represented somebody who really understands in her heart how important the role that you play is. And ironically, at the beginning of my week, I had another woman who came to Bay Path. I had never met her before. And ironically, both of these individuals talked about physician assistants in two different ways. Might be sad for you to hear one story, but I think that the second story, and the reason I'm using gratitude today, one of our employees, was a good story. But the first story of the woman I met at the beginning of the week is quite sad. She was a woman who chose health science as her profession, and she ended up teaching in Connecticut. And she taught clinicians. And she had a daughter who was a Bay Path grad. Graduated many years ago, never forgot her education at Bay Path. She went on to be an individual who did not work in the health field, but this mother was so proud of her daughter. And in January, her daughter passed away. And she shared that with us on Monday. But here's what she said. She said, "It was a physician assistant who gave me comfort, who gave her comfort." She teared up. She made me tear up. But she said that the physician assistant who was there to give her comfort really saw beyond the health issue of her daughter. She saw the pain in the mother's heart. And so she is making a major contribution to a hospital in Connecticut because of this physician assistant. And she's also making a very large contribution to Bay Path. But think of it. Someone took the time to look beyond the medical condition of the patient, the sadness of the death, but to understand the pain of the mother. And it was a physician assistant. And in the words that were just read to you by your mentors, I read it before it was read, and it talks about that very need for you to look beyond the medical condition that might be visible and to think about the pain and the hurt and the sadness that also is part of what you need to do as a physician assistant. Now, the good story of gratitude is the last appointment of my day. And this is a woman who, at Bay Path, you would never know that she had anything going wrong in her life. But she has a lot. She has a very ill husband. And she shared with me how proud she was that Bay Path had a physician assistant program. And she shared that it is the physician assistant working with her husband that has given him hope. So know that we have a lot to be grateful for today, for this program, for the people that direct it, for the people who teach in it, for all the clinical sites. But we have great gratitude that you chose this profession, and that when you leave Bay Path, you will leave knowing that you have had the very best education. Not just book learning, but you've learned something about the heart as well. So I congratulate you again. I congratulate your parents and your friends and your spouses and your partners who've been with you through your journey to this point. And I say how grateful we are that Bay Path has this physician assistant program. Congratulations.
So two very powerful stories that leaves us with high expectations of you, class of 2016. And it starts today. To the families and friends, and Dr. Lyria and Dr. Morris-Olson touched on this, may I first say on behalf of the faculty, we're sorry. We know it's been a haul so far, and we don't anticipate it getting much easier over the next few months. But again, they will flourish, and the next time we will meet will be in the spring of 2016. We will gather in our brand new building for maybe our ceremony and certainly the reception at their graduation and pass their boards and get a job, buy a BMW. They are today poised and ready to go. So congratulations to the class, and I hope you will all join us. We are going to have a reception in the Fireside Lounge in the Carpe Diem Cafe, which is in the Blake Dining Hall just across the street. And we look forward to meeting every single one of you. And would I ask the audience to please stay seated while the class recesses to the rear of the auditorium. Thank you for coming. Congratulations to the class of 2016. I'll see you soon.